In the last 3 decades, affective science or science of emotions, coupled with psychodynamic models of therapy inspired by Freud, propose new, brief, and more effective psychotherapeutic treatments. Especially effective approach within brief psychotherapy models is intensive short-term dynamic psychotherapy, or ISTDP, developed by Dr. Habib Davanloo in the 90s. Davanloo relentlessly videotaped and meticulously analyzed hundreds of hours of therapy sessions to determine the most efficient interventions, making ISTDP highly effective within relatively small number of sessions, a novelty that most of psychotherapeutic models could learn from. Today, growing number of studies confirms ISTDP's effectiveness in treating many psychopathologies, with strong pre to post-treatment effect sizes Cohen's d ranging strong from 0.84 to 1.51, rare for many other psychotherapies. ISTDP and psychodynamic model argue that mental disorders are closely connected with adverse childhood experiences in interaction with primary caregivers. These experiences generate strong unprocessed negative emotions, which, due to underdeveloped cognitive abilities of children such as reasoning, logic, or decision-making, end up buried deep in the right brain subconscious structures, hindering development of neural structures and creating problems with emotional regulation. Emotional dysregulation is shown to cause various problems such as personality disorders, depression, psychosomatic symptoms, or anxiety. This model has had an immense impact on methodological, ethical, political, and social factors in societies, altering childcare, schooling, social services, and legal frameworks. ISTDP presents an effective solution in the form of a roadmap which therapists may use to reach subconscious unprocessed negative emotions and bring them out into the present moment for experiencing, processing, and dismantling. The map consists of different levels of trauma that build on each other. So let's see how it looks like and how mental disorders may form in the childhood. Early interaction and attachment with the primary caregivers imbued with fear, stress, neglect, or rejection create a core level of unconscious trauma and emotional pain. Second level of rage forms because the child inherently wants to love its caregivers, but it can't. Third level of guilt forms because it is unacceptable for a child to hate its caregiver. Fourth level of sadness and grief is the result of feelings of guilt. Finally, in order to protect itself and survive in the world with all these strong negative emotions, child will form anxiety and various unconscious ego self-defense mechanisms. Self-defense mechanisms are unconscious strategies that help isolate and ward off unconscious feelings and impulses of trauma, pain, rage, guilt, and grief by suppression, denial, rationalization, or some other useful strategy that will keep damaging emotions in unconsciousness, enabling the child to function in its most optimal level. However, there are more or less adaptive self-defense mechanisms. For example, altruism as an adaptive self-defense mechanism helps the individual to feel better about themselves by helping others, while non-adaptive splitting self-defense mechanism may reduce the person to look at others or the world as either utterly evil or unconditionally good. The problems start when the child starts to introject them into its thoughts, emotions, and behaviors, causing long-term mental health problems. The goal of ISTDP method is to reach through all these layers of self-defense mechanism, grief, guilt, rage, and pain into the core of attachment trauma and to bring them out into the present moment for experiencing, processing, and releasing with the help of the therapist. Compared to other therapies such as humanistic, ISTDP extreme effectiveness comes from the fact that ISTDP therapist is not a passive agent, but the one who actively and compassionately encourages patients to open up the unconscious maladaptive impulses. Where other therapists just scratch the surface of the problem by addressing cognitive distortions, thoughts, or behaviors, often just intellectualizing or looking at the problem from different perspectives, or not recognizing, let alone addressing patient self-defense mechanisms, ISTDP bravely digs right into the core of the problem. So, how does that work in practice? Meet Kruno, the ISTDP therapist who will work with Eva, who shows up to Kruno's office with treatment-resistant anger management issues, headaches, and allergies, which other therapists could not solve. After initial assessment, Kruno forms ISTDP hypothesis that Eva's anger is related towards the important person in her past, her violent and aggressive father. Because of early trauma and strong defense mechanisms, this anger ended up locked up and suppressed in her unconscious mind, bursting anxiety inside of her body by causing psychosomatic problems and intermittently causing Eva to angrily overreact in many everyday situations. According to ISTDP, Kruno can work with Eva's anger within three domains called the triangle of person. The goal is to reach the past, or the bottom of the triangle. So, the maladaptive anger may show towards the current person in Eva's life, such as her partner or boss, towards the therapist, or the past figure, which is her father, or a core from which anger reflects upwards. However, Eva can't easily access this level of anger as it is deposited deep in her emotional core in childhood. Nevertheless, Kruno and Eva will eventually reach this level, after which Kruno will start working with an anger through a triangle of conflict. Triangle of conflict tells us that unconscious feelings and forbidden impulses are coupled with anxiety and excessive reliance on unconscious self-defense mechanisms, which block the experience of core anger. By actively blocking the defenses and carefully regulating Eva's anxiety, the core anger impulse could be brought out to the present moment for processing. So, let's see how this works in practice. For example, when Kruno will try to probe for Eva's feelings towards her father, Eva's intellectualization self-defense mechanism may trigger, and she will start extensively describing and analyzing her relationship with her father, while avoiding getting in touch with her core emotions of anger. This is where other therapies get stuck and continue to play along the defense mechanisms, never penetrating deeper to the core of emotions and impulses which fuel the disorder. However, in ISTDP, Kruno will identify and block the defense of intellectualization by pointing it out to Eva, clarifying its obstructing function and encouraging her to abandon it so she can get in touch with her underlying feelings of anger. Eva may also use other self-defense mechanisms such as denial, claiming that there is no anger towards her father, or humor by laughing and banalizing the relationship with her father. Aside from self-defense mechanisms, the more therapist pushes towards the core impulse emotions during therapy, the more anxiety may build up, which can completely block the therapeutic process. This is because anxiety is a biophysiological response to often unconscious perceived challenge and threats to emotional safety, autonomy, and connection, and has the role to protect the emotional core of the patient. Anxiety needs to be carefully monitored by focusing on a patient's body, as it is more visceral experience than it can be expressed through thoughts and words. Anxiety may occur in three levels. First level, called isolation of affect, represents a good anxiety tolerance and is an appropriate level to work with suppressed emotions. This level is recognized by tension in striated or voluntary muscles and can be detected in patients by monitoring for size or hand clenching. If Kruno pushes for emotions too much or Eva does not tolerate anxiety well, she may move to the next level called repression anxiety level. Here anxiety disappears in the body in the form of headaches, stomach nausea, allergic reactions, or muscle weakness. This may also occur in everyday life, as in Eva's case, and not just when probing for core emotions with the therapist. This level may hinder Eva's access to her core emotions and block the therapeutic process, so it's important to regulate the anxiety and bring her back to the first level. This may be achieved by calming her down and make her focusing on her bodily sensations and where exactly she feels the anxiety in the body. Finally, if Eva starts to experience the third, cognitive disruption level of anxiety, in the form of dizziness, fainting, dissociation, or visual and auditory changes, same block may happen and careful regulation is needed to lower the arousal. Finally, after carefully regulating Eva's anxiety while blocking and removing self-defense mechanisms that prevented her to express the forbidden feelings of anger towards her father, Eva will be able to reach and express it in a supportive and safe environment with the therapist. Releasing the core anger will also diminish the anger in her everyday life. Furthermore, anxiety that was disappearing in her body, guarding the core negative emotions of anger, is now not needed anymore, which will extinguish Eva's somatic symptoms such as allergies, headaches, or stomach problems. In conclusion, compared with the ISTDP approach, many other therapies get stuck with certain mental health problems because their interventions come to a halt when faced with patients' anxiety, or they endlessly play along the lines of self-defense mechanisms, or keep floating on cognitive levels of thoughts without ever reaching into the emotional core of the problem. In contrast, ISTDP detects and regulates the anxiety while building up patients' capacity to reach and experience their core emotions and impulses. Moreover, extinguishing patients' unconscious self-defense mechanisms immediately builds confidence and removes the veil of self-deception they had over their lives for years. This gets them in touch with core emotions that were fueling their problems so they can finally release them and live more happier lives.